Welcome to HCA Talks Health. I'm Zina LaRue, and our guest for today is Kate Chaynor-Norris. So Kate is a nutritional therapist and author of I Wish My Doctor Has Told Me This. Welcome, Kate. It's lovely to have you.
Oh, it's a joy to be here. Thank you.
So Kate, what led you to the work that you're doing today? Tell us more.
Oh, wow. I guess I've always been interested in bodies, and loved, I wasn't, terribly into school, but I did love biology,
Yeah.
and always kind of wanted to do some kind of alternative, complementary kind of health thing. But it took me a long time to find out what it was. And I went to see a nutritional therapist for my own health. And I was just totally hooked by what she was saying. And she said, oh, well, if you're interested, read this book. So I read The Optimum Nutrition Bible by Patrick Holford. And I was like, oh, my God, this is it. This is what I want to do. But then sort of had to go back to school and do my chemistry A level. But it was such a, I just loved every bit of it, all the study, and still do.
So you just were like a sponge. You just wanted to take in more and more, hey?
Absolutely.
Really interesting.
Well, the more you learn about the body, the more miraculous it is. And it's just, yes, mind-boggling.
So I really like the title of your book. I Wish My Doctor Has Told Me This. So I'm curious, what are the types of things that your clients or, even you wish your doctor has told you? What are the types of things that your clients wish their doctors had told them?
I think the most times that I get that comment being said to me is when I explain to people about how their body is working and that X symptom is coming from a certain underlying or a variety of underlying causes. Because I think the problem with kind of conventional medicine is, there's a lot of amazing stuff about it, but a lot of chronic issues, the only tools in the box that they have is medication, which kind of squashes the symptom, but doesn't really look at why the body has produced it. And that's what I love, is explaining to people, well, this symptom is happening because X, Y, and Z in your environment is happening. And we just need to adjust that. And bodies are, they respond amazingly quickly.
Can you give us an example of something that is linked to a root cause and how you would explain that to a client where they go, what? Is that really how this works?
Yeah. Well, I suppose one of the most powerful influences in our environment that completely kiboshes the body is stress. And because our bodies are sort of, as wonderful as they are, they're very slow to evolve. So they're still running on our kind of caveman stress, which was life-threatening. Our wonderful bodies haven't understood about 21st century stress, which is not life-threatening, but generally quite chronic. And because our body's remit is to keep us safe at all times, when we are stressed in a meeting, or we're late for work, or, we've just got this sort of overwhelming pile of emails to do, our body thinks there's a saber-toothed tiger around the corner. So it's preparing to do its fighting and flighting. But it means the downside of that is that a lot of the housekeeping jobs, things like digestion, detoxing, our immune system, regeneration and repair, they all get slightly shelved because it's not important if you're about to be eaten by a tiger, for you to eat your Weetabix, to digest your Weetabix properly, or fight the infection in your big toe, or, all of those things. So that's, I think, one of the things that I end up explaining to my clients most of all. But, there's many things. I mean, a lot of gut issues where people have been given either acid suppressants or antispasmodics for their kind of gut symptoms. And generally, we're looking at a kind of imbalance in gut bacteria. That's so key, because if those guys are in there and there's an imbalance of good and bad, and we always really want the good guys to be running the show. But a lot of pathogenic bacteria will feed on certain foods and create a lot of gas and bloating and kind of symptoms. So yes, I mean, there's so many things. And I guess explaining to clients that everything in the body is linked to everything else. So we can't split things off. So, for instance, if somebody comes to me with depression, I'm going, okay, well, we need to look at your gut symptoms. We need to look at your liver. We need to look at your stress response. I mean, there's so many things that come into the pot that could be creating that symptom. And that's, I guess, it's the sort of education of people about their bodies. And everybody's always really interested, because our bodies are amazing.
And I do find it quite sad that not many people are aware of it. That, oh my gosh, my mood might be tied to my gut and the microbiome. And this is where I think the proactive versus reactive model comes in, right? Addressing the root cause instead of just treating the symptoms. And unfortunately, that's often what happens when people go to the doctor. So I think the title is so spot on. I wish my doctor told me that my mood might be linked to my gut, or I wish my doctor told me that stress is impacting my body. It's causing my infections not to heal, or my digestion not to be optimal. And this often makes a lot of sense if people first understand this and they realize the intricacies and the nuance in the body of how it all works. So one of these things that I know you are really interested in as well is Alzheimer's disease. And you studied under Dr. Dale Bredesen. So for those listeners who don't know Dr. Dale Bredesen, can you give us a little bit of background on just more about him and his approach?
Well, amazing chap, American doctor who, I guess, kind of looked at Alzheimer's through a kind of, different lens, a much more holistic box. And again, rather than, so many of the medications for Alzheimer's are focusing on trying to get rid of the plaques in the brain. So part of Alzheimer's is that, your brain creates plaques in the brain, which means that the neurons are not able to function quite as efficiently as they should do. And so a lot of the medications are trying to get rid of those plaques, but actually those plaques are the brain trying to protect itself from the environment. So Dr. Bredesen went, okay, so what are all the factors in the environment that are affecting our brains? And he has broken down Alzheimer's into kind of the 6 different subtypes, which are the 6 major underlying causes. And that doesn't mean to say that if you have Alzheimer's that you will only have one of them. You may have a mixture of them. But I would say absolute number 1 is sugar. I know it's such a boring message, but if your brain has become insulin resistant, so I don't know, I'm sure lots of your listeners know what insulin resistance is, but I will just very quickly explain that when we eat sugar and we have sugar in the bloodstream, because sugar causes damage, it sticks to things, it creates cardiovascular disease and all sorts of other problems. We need to get that sugar out of the bloodstream quickly into the cells so that they can be used up as fuel. If we have our blood sugar levels swinging up and down a lot, and a lot of sugar is there, and a lot of insulin is always asking the cells to take up sugar, eventually they kind of start to become resistant to the insulin message. And that can happen in the brain cells. So you've got sugar in the bloodstream, in the brain, sticking to things, causing damage. But also, when the cells become insulin resistant, it means it can't get sugar into the cells. So the cells start starving. That they really need the fuel. And that can be a kind of brain fog kind of symptom that people might be getting. So I would say that's probably one of the most important elements of Alzheimer's. But there's also there's toxicity. We live in an incredibly toxic world. It's really, there's no way of sugarcoating the pill. Everywhere in the world is contaminated with all sorts of things. And we've created all these chemicals to supposedly make our life more convenient, but they are really toxic to the human body. And so those toxins in the bloodstream can cause damage and inflammation in the brain, particularly things like herbicides, pesticides, plastics, massive problem. But also things like mould. A lot of us live in mouldy houses, and it's not, you don't necessarily have to have mould growing on the walls to think, oh, I live in a mouldy house. There can be sort of mould behind the paint. And those spores are triggering our immune system. Alzheimer's is a very inflammatory disease. Well, as is all chronic disease, there is a bedrock of an inflamed body. And when you're being exposed to a lot of toxins, then you are over alerting the immune system. So you have a lot of white blood cells, going around, and it can be, the body is just systemically inflamed. So the other things that kind of can be big underlying causes are hormone imbalance. One of the reasons why more women than men get Alzheimer's is because of this estrogen imbalance. So as we get older, we go through the menopause, our estrogen levels drop. And one of the things that estrogen does, which is so important, is it helps to soften the plaque in the brain. Now, at nighttime, that's when we do our brain cleaning. And so we're lying in bed, our brain cells shrink a tiny bit, so you get a bit of a vacuum. So you get a lot of cerebrospinal fluid flowing up into the brain to do a clean out job. And if you've got good levels of estrogen, then it means that the plaque is soft enough for it to be cleared. So if we have women who are estrogen deficient, then obviously that can have a real impact, along with, all the other hormones, things like cortisol, again, that kind of stress hormone, and sort of chronic stress causes a lot of chronic inflammation in the body. So, yeah, there's a huge amount of things, and making sure that the body has enough nutrients to work properly. If our digestion is compromised, as we get older, we can have lower levels of stomach acid, and then we're not breaking our food down properly. So really important nutrients like zinc and selenium and choline. I mean, really, really important, for lots of eggs. I'm a big fan of eggs, to help with the kind of cell membrane structure. So I think, a lot of people now, it's hard for us to get good nutrient levels from our food. So on top of the fact that their digestion might be a bit compromised, it's a problem, and then we could have, the other thing is kind of looking at people's bacterial or viral load. Many people have long-running viral infections. They don't tend to get overt symptoms, but it's just kind of running the system down. And one thing I have been, really interested in is dental health and the correlation between certain bacteria in our mouth that is linked to Alzheimer's, and it's really strong correlation. So if you have a bug called P. gingivalis in your mouth, you have a much higher risk for getting Alzheimer's. So again, when I talk with clients, we don't just do nutrition. I'm asking them, have you had any root canals? What's your gum health like? Getting them to do oil pulling or using a probiotic toothpaste, just to make sure that, your mouth is the beginning of the alimentary canal. So if it's good up here, that's a good start, because you're not going to be swallowing these kind of pathogenic bacteria into the gut.
What would some of the reasons be for someone to have that specific bacteria in their mouth, or is it just an imbalance?
It could be many, many reasons. I mean, it just generally not, very good oral, cleaning. But again, if your immune system is compromised, any autoimmunity, it means that the immune system is kind of busy, being kept busy elsewhere in the body. And we are being exposed to bacterial and viral infections all the time. I think if people could actually see them, they'd be horrified. You take a mouthful of food, it's got a huge amount of bacteria in it. You'd be thinking, oh no, I don't want to eat that. But we tuck in, and a healthy system with really good stomach acid is going to blitz those bugs so they don't get further down into the gut. So yeah, it's a tricky one, and Dr. Bredesen's program is amazing, and he gets amazing results, but it's not for the faint-hearted. You really have to do the homework. He has this sort of diet called the Keto-Flex diet. So it's basically ketogenic. And yeah, so getting those blood sugar levels controlled is absolutely key, and getting our cells really insulin sensitive so we can get the fuel into the cells. Other things like exercise, there's a lovely substance in the body called BDNF, which is brain-derived neurotrophic factor, which is basically described as miracle grow for the brain. And all the great things that are, can help to boost that, choline being one of them, but also the kind of HIIT exercise, high intensity interval training. Really kind of, it sounds kind of counterintuitive, but really stressing the body helps to kind of ramp it up. It's like, cold showers, cold swimming. Our bodies are built for physical stress, and because our modern day worlds are kind of a bit soft and sappy and a bit too comfortable, we don't really have to use our bodies as we used to. We don't get really cold, we don't get really hungry, we don't get really thirsty. And all of these stresses have been shown to be really beneficial for the body. It's going back to our caveman days, if you got really hungry and you hadn't eaten for a couple of days, your body needs to really ramp itself up and be super sharp to go off and hunt the saber-toothed tiger. So stressing the body is actually really a good way of kind of getting everything to ramp up. When we are fasting, past, I think it's 17 hours of fasting, we then click into a process called autophagy, which is basically self-digestion. So the body starts clearing out all those old manky cells, which is super helpful. But again, in a world where we have abundance of food and people are snacking all the time, they never have that lovely period of time where the system can have a bit of a rest and a clear out.
So what's the difference between, you were saying that cortisol is not necessarily a good thing because it creates inflammation in the body, right? So is it more about having the acute stress every now and then compared to that chronic low-grade inflammation in the system? Is that what we need? 100%. High periods of stress, but then it needs to go away. Is that right?
Yeah, absolutely. Yeah, I think it's that whole thing of, that super stress in the moment. And that's what, we are designed to do that. We have an incredibly quick reactive system to deal with danger. That HPA axis is absolutely, buzzing. But we are not designed to do that on a chronic basis. So, again, living in caves, you go out, you do your hunt, masses of stress hormones, but you'd come back and you'd chill out in your cave and you'd watch the sunset and, maybe watch the fire. There wouldn't be a whole pile of emails for you to deal with. So the whole system would be able to kind of reset and recalibrate.
So with that, would you still recommend some of those interventions to someone who is already highly stressed? So let's say they're meeting a lot of deadlines, they're in a really stressful relationship. Would you still recommend they do HIIT, high intensity interval training, and cold exposure? Would that then benefit them?
Yes, I would. I mean, it's a difficult one. If you've got somebody who is super, super stressed, and they're very wired all the time, there's kind of different levels of stress. You can get people who are like super wired all the time, manic, with a lot of energy. And that's when their cortisol levels are really high. But as time goes on and that chronic stress goes on for longer, the adrenals get to the stage where like we can't produce that volume of cortisol. So you might feel wired and stressed, but you're also feeling really tired.
Yeah.
So that's the kind of wired and tired thing. And I think for me, it's always about listening to your body. If you go off and do a HIIT session, and you come away feeling brilliant afterwards, that's a sign that your body's okay with that. But I find sometimes, if people have been long-term chronically stressed and they go off and they expect, to do a 20-mile run and feel wonderful afterwards, and they don't, they feel absolutely wiped out, then that's the sign that actually maybe you should be doing more exercise, kind of strength training, yoga, Pilates, Tai Chi, the more mindful, slow exercises where you're building strength in the body, but you're really having to focus in on the body and concentrate on your breathing, because that's much more calming for the system than going and running a marathon in the gym or, whatever other crazy things people like to do.
Yes. So looking out for those signs of burnout, I guess. And like you said, listening to your body, maybe this is not the right. So it's not everyone out there listening today should necessarily take that approach. It will depend. So I think working with a professional and listening to your own body might be really useful.
I think that is the number one thing, it's getting us more in tune with our bodies. I think this society where we've created so much busyness and so much sensory overload, we've totally lost touch with our systems. And they are speaking to us all the time. And our bodies are infinitely wise. They do know what they're talking about. But sometimes the symptoms that they give us are inconvenient, or you're like, I haven't got time for that. I'll just take a pill. Got a headache, take a pill. And you're like, that's not what the body was asking for. It maybe needed a rest or a bit more water or some good nutrition or, all sorts of other things.
Exactly. But there are a few, I want to say, fundamentals that we can really focus on that I find could make a difference in many areas of our health. These things that you've mentioned today, right? So sugar, if we reduce sugar, it's going to be beneficial on many different levels. But I mean, that might be why, or I guess that's why Alzheimer's is also referred to as type 3 diabetes, right? Because of the big impact that sugar has, right? Yeah.
Huge. Yeah.
Yes.
Absolutely.
And then inflammation. So a chronic low-grade inflammation in the system is never a good thing. And it is going to impact all the different cells in the body and especially the brain. And then I've never heard about the hormonal imbalance and how estrogen, the important role of estrogen. So what would your recommendation be there? So would you suggest hormone replacement therapy, or what's your typical approach?
I think it has to be a totally individual approach. I mean, I would never recommend doing HRT unless that person had a very specific hormone test done to see exactly what their body needs. Because unfortunately, again, there's a sort of what slightly one size fits all approach. When people get menopausal symptoms, they don't necessarily always need estrogen, but they tend to always be given it. And also, I'm keen on the testing where you either use saliva or urine. Blood tests for hormones, they do a snapshot of what is in the bloodstream at that point in time. Whereas with urine and saliva, you're looking at the metabolites of the hormone, which gives you a much broader picture of what has been in the system. And also, I'm very keen on looking at, there's 3 different types of estrogen, and looking at all 3 of those, because estriol, the third one, is very protective against breast cancer. So making sure that if you are going to supplement estradiol, which is the punchy one, which is the one that can be driving things like breast and prostate cancer, that the balance is absolutely right. So and also making sure that a woman's liver is working really efficiently, so that you're clearing out any excess hormones. There's some great supplements, and also just foods. All the cruciferous vegetables, they're full of amazing nutrients like sulforaphane, which helps the liver to detox these things. So I do think that HRT can be an absolute lifesaver. But I'm really passionate about making sure that, people, if they're going to take it, they are taking exactly what their body needs, and titrating the dose up and down. Because I've seen time and time again, where, women have been given this kind of one size fits all protocol, and their body really, really doesn't like it.
No. Exactly. And there's many other things that we could put in place before we necessarily have to take that step. So
yeah, absolutely. And again, the stress levels, because if you look at how all the hormones work, the sex hormones are at the end of the line when it comes to hormones, and if you've got your body producing loads of cortisol, it doesn't get down to producing the sex hormones. So for me, yes, balancing that stress is just so key. And I wish, I always say to my clients, if I could have a pill, if I could create a pill that made people feel safe in their bodies, I would clean up. I mean, it just would be fabulous. But unfortunately, we don't have that. It's about really tuning into the body, listening to when it is feeling stressed, because very often if we run chronic stress, we don't realize that it's stressed because we're so used to that feeling. It becomes the norm, because our body just goes, oh, well, there's a saber-toothed tiger around the corner 24/7, so we're just going to run this fight flight high all the time, so we're absolutely ready to fight or flight. And so it becomes normal. And I think it's about getting people back in touch with their bodies, so they're like, oh, actually, yeah, this is not great, and what can I do to override that? And it's very often more difficult to override that stress response with thoughts. It's about speaking the body's language, and that's why breathing, I know it's such a sort of, everybody talks about breathing, but it's the quickest way of getting into the body and going, all is well. Because if we are breathing in a certain way, it just indicates to the body that it's safe. Generally, if we're stressed, we're breathing shallowly and up in the chest. And of course, that feedback mechanism goes up to the brain and goes, oh, must be a saber-toothed tiger. But if we override that, one of my favorite breath techniques is the physiological sigh. I don't know if you've heard of that. I mean, it's just fabulous. And so, you're breathing in, taking another breath in, and then breathing out slowly. And it's just amazing. My clients, I do it with them, and instantly you do 2 or 3 of those, and they're like, oh, my body just feels totally different.
It's almost like a nervous system reset, right? That sigh.
Completely. Yeah. So that's hugely valuable, I think. Probably one of the most valuable things that I do with clients.
The breath is very, very powerful. And I think what you're saying, firstly, we need to have that awareness. So we can't do anything about it if we don't realize, oh,
Yeah.
I'm really stressed. This is not good. This is not normal. And then having the tools in our toolkit to do something about it. And that those tools should come through body-based interventions, breath, movement of the spine, things like that, to show the body that it is indeed safe. I remember a friend telling me a while back, she said, Zina, in my mind, I know that I'm safe. Like it's obvious I am safe, but I don't feel it in my body. My heart is racing, my breath is shallow, and that's exactly it. Those memories are stored in the body, so we need to, like you say, use the body's language to communicate back to it and say, "Don't worry, you are safe indeed."
Yeah, I know, it's amazing. I don't know if you've read the book called "The Body Keeps the Score."
Yes, I have.
By Bessel van der Kolk. I mean, that's just such a revolutionary book, but such an amazing idea that our body, well, as Bruce Lipton says, our biography becomes our biology, and that our body holds onto our story, our life story. And if it's a good energetic resonance, then all is well, the cells are happy. If it's not, then you're knocking the cells energetic resonance out, and of course that's going to cause dis-ease.
Exactly, and that's why taking a look at the bigger picture of a client when we're working with them, it's not as simple as just increasing the anti-inflammatory foods in their diet, although that might be a first step, right? And that could be really beneficial. Absolutely. But often there's a bigger story, something that we need to listen out for. And I think as health coaches, that's a really, really important part of our job, is to listen and figure out what's going on for this client. Where are the gaps for them? Right.
Yes. Yeah. And I think, for clients, as you say, just that therapeutic space where they are being heard. So many of my clients come away from a session and they go, I feel better already. And we haven't done anything, but I've just listened. And that kind of offloading is really powerful.
Because people don't get it in their everyday lives. They're really not truly listened to. We listen to share our own perspectives or to interrupt someone, right? That's often how it happens in an everyday conversation. So most people are not listened to. So I often also tell students that, if you just show up as a coach and you truly listen, you create that thinking environment for a client, you have offered them so much more than they get in their regular day-to-day life.
Yeah.
Right? Yeah.
And actually, I don't know if your coaches feel this. I find if I'm really busy in life, one of the most relaxing things that I do is to do a consultation, because initially when I started, my brain will be whirring, thinking, what am I going to do with this person? What am I going to do with this person? Whereas now I'm just like, I trust it will come. And just so, to just really, really listen and focus in on what they're saying. And you can get some real gems, total gems coming out, if you give people the space, which is sometimes that nugget of what's really important. That's what we need to be focusing on.
That's it. Yeah. So we've touched on many different things, but there's one other area that I'm also want to find out about. What about sleep? What about sleep's impact on the brain and the link to cognitive decline?
Oh, key. Again, like I kind of talked about, sleep is the only time when you will do your brain cleaning. But again, we do so much other stuff, when we're asleep, all that kind of regeneration and repair. The liver does most of its detoxing when we're asleep. And that's why I'm a big fan of, giving yourself 3 to 4 hours of fasting before you go to sleep, so that when you are asleep, your liver is not having to be busy digesting. It can actually do its detoxing job. And again, that whole thing of sort of setting your circadian rhythm, our bodies work on 24-hour systems. Our hormones are fluctuating within that 24-hour system, and bodies like routine. So I would sort of say, try to have a bedtime where always are going to bed at the same time and generally always getting up at the same time. And I always say to clients, in a perfect world, you would be waking up without an alarm clock, because then we know that you've had enough sleep. If you are, rolling over and going, oh, I need to hit the snooze button, that's a sign you need to get to bed earlier. And again, it's this kind of the world. I think things are changing now, but there was a real badge of honor. Oh, I can only survive on 4 hours sleep a night. And you're like, there will be a long-term consequence to that. They say in my book, the two kind of very famous people who were notorious for not needing much sleep were kind of Margaret Thatcher and Ronald Reagan, and they both ended up with Alzheimer's. And I can't say there was a direct correlation, but I just think it's important that people need to be aware that running on a small amount of sleep is not a long-term strategy. And if you read books like from Matthew Walker, his amazing sleep book, you'd think, oh my God, I'm never going to miss a minute's sleep ever again. Because it's such an incredibly valuable tool. And also it's a weight loss tool. If you are lacking in hours of sleep, the general rule of thumb, which they've done with studies, is that you will eat an extra 300 calories the following day if you're lacking in sleep. So again, so many benefits.
But I guess it's not always a choice, right, for people to get more sleep if they can't sleep, or if they wake up in the early morning or can't fall asleep. And then, of course, we need to look at some other interventions and strategies for them.
Yeah. Absolutely, yes. And again, not sleeping can have so many underlying causes. But for me, a lot of them are, to do with our stress response. If we are permanently stressed throughout the day, our body is not going to just fall into bed at the end of the day and go, all is well, all is safe. There's still that hypervigilance going on. It's not safe for us to have good quality deep sleep. And also kind of making people aware of, what their evening routine is doing. I often talk to clients, and I think they think I'm being really nosy. I go, well, what do you watch on telly in the evening? And, so many of them go, oh, I love a good drama or a good thriller. And you're like, well, just to make you aware, if I put monitors on your body while you're watching Silent Witness or whatever other kind of, scary things, your body will be full of stress hormones. Our systems cannot differentiate between what it's watching on telly and reality. So it thinks that's really happening. So you go to bed full of stress hormones, expect it to sleep, and it's going, but it's not safe. And people just don't have that kind of awareness about that lovely, gentle winding down. When we have small children, we always go, at the end of the day, he needs to be calm and quiet, give them a nice bath, bedtime story, winding everything down. Well, that's exactly how we should be as adults.
Yeah.
Same story.
Yes, we need the same things, exactly. And our bodies we need to prepare them in a way to tell them, okay, it's time, it's safe.
Yes.
You can go to
absolutely.
bed. It's important. Okay, so thank you, Kate. That's been really insightful. If there's one thing that you would like listeners to take with them today, what would that be?
Wow. I think I'll keep it really simple. I mean, I could have said sugar, but people are really bored of hearing that message. I would say be aware what your breathing is doing all the time. Just check in with your breathing all the time, because it's obviously something that we do all the time, but depending on how you are breathing just dictates how well your body is functioning.
And it's really there at the core, at the center.
Yeah, absolutely. And again, if we are breathing properly and we're not stressed, that can lower our blood sugar levels. So that's how it's kind of linked.
Okay, so you do come back to the sugar.
Do come back to sugar.
Yeah, fantastic.
But yes, I mean, so many things. But yeah, I would say that's sort of, if people could tune into their systems and reassure them with that lovely slow breathing, that would be really helpful.
Great takeaway. Thank you. Okay, so if someone wants to reach out to you today, listening to our conversation, where could they find you?
My website, which is just Kate Chaynor-Norris. If you feed that in, it will come up, and that will take you to my website, where I've got obviously my book. People can, ask for appointments, or I've also got a reversing diabetes and weight loss online 6-week program that people can do, which again is sort of this whole maintaining metabolic balance in the body is such an important part of health and well-being. So I sort of wanted to try and get something that people could do in their own time. But it's a very holistic approach. We're not just talking about, reducing sugar.
No, it's so much more. And I definitely get that from our conversation today. We have to look at the bigger picture. So thank you, Kate. Thank you so much for your time today. It's really valuable to learn more about this topic. And, I always find it really fascinating to be reminded of how much really is within our control. What are the things that we can do? Yes, some things we don't have control over, but there are quite a lot that is within our control when it comes to our health. And I think it's very empowering to be reminded of that. So thank you so much. It is.
Yes. Well, thank you so much for having me.
Thank you, Kate. All the best.
Okay.
If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and well-being coaching, visit www.healthcoachesacademy.com to find out more.